Top stories tonight in Y News. COVID-19 cases in the Philippines reaches the 3 million mark. Malacanang says the government is prepared for the possible escalation of the National Capital Region to alert level 4.
The World Health Organization refutes the alleged combination of or merging of variants Deltacron, likely a contamination during sequencing.
Comelec removes another presidential aspirant from their list.
And infra and agri damages caused by Typhoon Odette soar to 28 billion pesos. Good evening, Philippines and the world. We are now reporting live from Quezon City. Today is Tuesday, January 11, 2022. Join us in the next hour as we deliver today's top stories around the Philippines and in other parts of the world. I am Herlene Delgado.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo. First in the news, the Philippines breaches 3 million COVID-19 cases. This as the country recorded 28,007 new cases today, pushing the nationwide case count to 3,026,473. The cases brought by the number of active infections nationwide to 181,016. Of these active cases, 170,873 patients were experiencing mild symptoms, 2,863 were in moderate condition, 1,464 were severe, 295 were critical, and 5,521 were asymptomatic. The number of survivors went up by 4,471, bringing the total number to 2,792,946. The death count, however, jumped to 52,511 after 219 new fatalities were confirmed today. Meanwhile, the overall global COVID-19 caseload has topped 310,495,957, while the deaths have surged to 5,495,441, according to the Johns Hopkins University. The United States is still the worst hit country with the world's highest number of cases and deaths at 61,658,000. And 839,497 respectively, according to the CSSE, followed by India and Brazil.
The health department belies claims that the effect of the Omicron variant is mild. They explain that there is a reason why the severe and critical cases caused by the variant of concern are low. Aiko Miguel tells us why live. Yes, Aiko?
Yes, Arlene, high vaccination coverage is the reason why there's a lower percentage of severe and critical cases in the National Capital Region, according to the Department of Health. Based on the report of the Metropolitan Manila Development Authority, there are over 160 million individuals who have been fully vaccinated against COVID-19 in the region. This amounts to 106% of NCR's target population. However, mild and asymptomatic cases are increasing. Here is Undersecretary Maria Rosario Vergere, the spokesperson of the DOH.
Even though it's mild, pag tumama po yan sa vulnerable na populasyon natin, maaari pa rin sila magkaroon ng severe infections. So kailangan lamang po talaga na maintindihan natin, the vaccines have protected us and it's showing us that it can protect us.
Arlene, this is why, according to IATF data analytics expert group member Dr. John Wong, non-NCR regions, particularly the Visayas and Mindanao region, should also strive to have a higher vaccination coverage. He added that during the Delta surge, Metro Manila has 24% fewer hospitalizations compared to other regions.
Before the surge arrives in the other areas, we have to vaccinate them to a very high level.
Health experts also remind the public that Omicron should not just be considered as a mild disease, for it could also burden the country's healthcare system. Here is Dr. Edsa Salvania, infectious diseases expert and member of the DOH Technical Advisory Group.
and we're not calling Omicron mild. It's milder than Delta. Delta is 3 times more likely to land you in the hospital compared to Omicron. But Omicron can still land you in the hospital, which is a very important distinction. The nature of Omicron is also that the incubation period is faster than yung sa Delta. Before, it used to take about 5 days to develop symptoms. For Omicron, it's about 3 days. And if you consider that people are already contagious 1 to 2 days before they are symptomatic, for Omicron, you're almost contagious just a little over 24 hours. So it's very, very difficult to contain something like that.
The DOH also said, Harleen, despite the case increase, the national healthcare utilization remains at low risk. And that is the latest live. Back to you, Harleen.
Thank you, Aiko Miguel, reporting live.
Meanwhile, the World Health Organization, or WHO, on Monday appealed not to use terminologies or the merging of the names of 2 existing COVID-19 variants. According to WHO COVID-19 technical lead Dr. Maria Van Kerkhove, these terms imply a combination of viruses or variants, saying this is not happening. Dr. Van Kerkhove added that the emergence of Deltacron is more likely a contamination during sequencing of COVID-19 samples. WHO is the one agency responsible for the naming of COVID-19 variants of interest and concern. It assigned last year the use of the letters of the Greek alphabet for simple and easy to say labels for variants of interest and of variants of concern. Aside from being easy to remember, this prevents people from calling variants by the places where they are detected, which according to the International Health Agency is stigmatizing and discriminatory.
The health department has clarified that the Delta variant still has the highest detection rate in the country. This comes after Health Secretary Francisco Duque III presented during the public address last night that the Omicron variant has replaced Delta as the dominant variant. Health Undersecretary Maria Rosario Berjera explains the secretary was pertaining to the last genome sequencing run. Philippine Genome Center, or PGC, Executive Director Dr. Cynthia Saloma also clarifies that further evidence are needed to conclude that Omicron is now the dominant variant in the country.
Yung ating whole genome sequencing data, yung sinabi sa atin the secretary, was primarily based on the 48 samples. I think for further conclusion, we need to get more samples from our local cases so that we can have a better handle on the situation and kung talagang ang Omicron na ba ay talagang nag-overtake na sa Delta.
Hindi po kinontra ni Dr. Cynthia Saloma si Secretary Duque. Ito po ay ipinaliwanag lang niya kung ano po ang lumabas sa ating whole genome sequencing results. He was explaining about the most recent run. Dahil yung most recent run po, nakita po natin na mas madami po ang Omicron detections kumpara sa ibang mga variants na atin pong nakikita dito sa ating bansa. Sa ngayon po, ang Delta variant pa rin po ang pinakamataas na mayroong lineage dito sa ating bansa, comprising about 43% of detections. And ang kasunod po nito, 18% for Beta variant, 15% for Alpha variant. At para po sa Omicron, totaling 43 detections, ito po ay 0.21% pa rin.
Duque says 60% of the 48 samples sequenced were found positive for Omicron variant, with 29 cases, while 18 cases for the Delta variant. Currently, there are 43 official cases of Omicron variant in the country, with 21 local cases and 22 cases detected from international travelers. For now, Saloma says the country is still free from other newly reported variants like the IHU variant.
Virus is always mutating and is always evolving. So far now, the most evolved variant of SARS-CoV-2 that we have is this Omicron variant with so many mutations. So, paano natin ma-secure ang ating na hindi tayo pupunta sa atin? As much as possible, of course, to strengthen our border controls, and at the same time, individually and collectively, very, very important po na magpa-vaccine tayo.
The PGC hopes to release the results of the bigger sequencing run of 500 to 700 samples before the end of the week.
Meanwhile, the palace says the government is prepared in case Metro Manila needs to be escalated to COVID-19 alert level 4. This following the record high number of new COVID-19 cases in the country due to the more transmissible Omicron variant. Rosalie Cos has the details.
The government has been preparing in case Metro Manila is upgraded from COVID-19 alert level 3 to alert level 4. This is the response of acting presidential spokesperson and cabinet secretary Carlo Nograles when asked if the government can afford an alert level 4 scenario.
We have been preparing naman, no, our hospitals, and which is why there's a call to increase the bed capacities. Diba? There's a call to increase the capacities of our TTMFs or our isolation facilities. And then of course, we are doing real-time updating on our healthcare workers din. Then yung augmentation ng healthcare workers. So all of these we're doing in preparation for that eventuality.
According to the data of the Department of Health, the National Capital Region has recorded 100,087 new cases in the last 14 days. Quezon City has over 22,000 new cases, while Manila has more than 17,000. Despite the high number of COVID-19 infections reported recently, the healthcare utilization rate in Metro Manila is still at moderate level. It is yet to reach the threshold for it to be placed under the stricter Alert Level 4. Alert Level 3 is set until January 15 and the Interagency Task Force will be meeting for the new round of quarantine classification on Thursday. Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Health reported that there were 6,595 healthcare workers who are under quarantine due to exposure to COVID-19. This is 7.2% of the total workforce of healthcare workers in Metro Manila. According to Health Undersecretary Leopoldo Vega, hospitals are forced to close down other services to deploy their personnel and address the staffing shortages.
Almost na-quarantine, na-isolate na healthcare workers, mga abot na ata ng 6,595 out of 91,838 healthcare workers. So mga 7.2% ito under quarantine. So ang ginagawa ngayon ng mga hospitals, lalong-lalo na sa mga bigger centers, focus sila ng ibang services para ma-redeploy yung mga areas na kailangan for COVID ng kanilang mga personnel.
COVID-19 vaccines for children ages 5 to 11 years old are set to arrive in the Philippines by the end of this month. Vaccines are Secretary Carlito Galvez Jr. says the government needs 26 million doses of COVID-19 vaccines for this said age group. Eileen Cerudo tells us why.
The Philippines wants to start vaccinating children aged 5 to 11 against COVID-19 come February. This is highly possible as the supply of vaccines for the said age group is expected to be delivered before this month ends. According to Vaccine Czar Secretary Carlito Galvez Jr., over 15 million COVID-19 vaccines for 5 to 11-year-old children is needed, including booster shots. Several local government units including Taguig, Pateros, and Manila have already opened pre-registration for the vaccine rollout to streamline their vaccination drive.
Yung children population 5 to 11 years might be available by the end of January. Ito po yung last contact po namin sa ating mga manufacturer, and we are now making some contingencies to acquire doses that we need to include the ages 0 to 4 years old.
Secretary Galvez also said that the government is also working on the vaccination rollout for children 0 to 4 years old. He disclosed that talks with manufacturers continue in order to procure more vaccines with formulation fit for the said age group. More than 11 million of primary series vaccines are needed to be procured to vaccinate children 0 to 4 years old in the Philippines. The national government projects vaccination rollout for them will begin by the end of June. Meanwhile, pediatric infectious disease expert Dr. Ana Onglen assures parents that children vaccinated with COVID-19 will not experience any unique side effects or adverse events different from those experienced by adults.
Ang nakikita naman sa mga pag-aaral sa ngayon ay kung ano yung mga adverse reactions na meron sa mga matatanda ay siya rin ang nakikita sa mga bata.
The national government aims to fully vaccinate 90 million of the country's eligible population by June 2022. As of this month, there are over 52 million Filipinos fully vaccinated against COVID-19. Eileen Cerudo, UNTV News and Rescue. We serve the people. We give glory to God.
The Philippine Health Insurance Corporation still owes 25.45 billion pesos of unpaid claims to some hospitals, but the state insurer vows to pay its dues within 6 months. Nelmari Bahok tells us why.
PhilHealth's President and CEO Attorney Dante Gueran reported to lawmakers that their payments to COVID-19 claims has improved. According to Gueran, PhilHealth paid 3.1 billion pesos COVID-19 claims in 2020 and 14.9 billion pesos in 2021. The PhilHealth chief assures lawmakers that they will settle the in-process claims of hospitals that are due for payment worth 25.45 billion pesos.
Itong in-process po namin na 25.45 billion po. We have to pay this in 6 months' time.
Gueran also said during the House Committee on Health hearing that they already met with the 7 hospitals who wants to disengage from PhilHealth.
Sinabi doon na within 90 days, no? Within 90 days, bayaran namin yung ganong kalaking utang. And of course, we have to show something that is also concrete para naman sila maniwala. So, within within January 31 of this year, hopefully, we will be able to deliver.
But Dr. Jaime Almora, president of the Hospital Association of the Philippines, said that the current policy of the state insurer prolongs the claims reimbursement.
Our suggestion is we just make it plain and simple. We do case rate payment. If there is a patient is actually admitted, there is actual diagnosis made, there was properly diagnosed and properly treated, then we pay right away. I don't think that will take more than 5 minutes to evaluate a case.
But the PhilHealth chief countered the proposal, saying that they need to abide with the Commission on Audit's recommendations.
But the COA has other thing in mind. Na PhilHealth should have only pay the lower of the two. Meaning, kung mas mababa ang statement of account po actual, ang babayaran po ay ang actual. Na kung malaki naman ang actual kaysa case rate, ang case rate po ang babayaran po.
PhilHealth said they will resolve their problems regarding the IT system and manpower shortage this year to fast-track the processing of claims. Nel Maribuhok, UNTV News and Rescue. We serve the people, we give glory to God.
In other news, from 25 billion pesos last week, the total cost of damage to agriculture and infrastructure caused by Typhoon Odette soars to 28 billion pesos. In its report released today, the National Disaster Risk Reduction and Management Council said that damage to agriculture is at 10.9 billion pesos, while damage to infrastructure has reached 17.7 billion pesos. Out of 8 airports affected by the typhoon, 2 remains non-operational. Power and water supply are yet to be restored in a lot of cities and municipalities. The number of confirmed deaths is at 405, while 65 are still missing.
Several presidential aspirants are demanding government's action over an alleged hacking of the Commission on Elections system. Nel Maribuhok has the details.
Senator Panfilo Lacson said that despite their limited accessibility, their own Comelec accredited cybersecurity team is investigating the alleged hacking of the Commission on Elections servers. The former PNP chief said finding out who was or were responsible is already material information to establish the motive behind the cyber attack. He also said that Comelec should clarify the veracity of the hacking incident and be forthright with its findings. The official added that the poll body should be open to letting experts and stakeholders help in strengthening their security system. Meanwhile, Senator Manny Pacquiao has called on the Senate Committee on Electoral Reforms and People's Participation to immediately conduct a probe regarding the incident. He said the Congress should exercise its oversight powers in relation to the automated election law. Pacquiao said that the probe is important because if the automated system has been compromised, the Comelec must be able to present a backup plan to ensure that the election would proceed as scheduled. Vice President Leni Robredo and her running mate Senator Francis Kiko Pangilinan also expressed their alarm over the reported data breach. They urged the Commission on Elections to immediately take steps to ensure that this or any other similar incident would not affect the integrity of the May 2022 elections. Former Senator Ferdinand Bongbong Marcos' camp meanwhile said that they are keenly observing the development. Other presidential aspirants are yet to comment on the issue. Nel Maribuhok, UNTV News and Rescue. We serve the people, we give glory to God.
The National Bureau of Investigation, or NBI, may provide assistance in the Commission on Elections investigation of the alleged hacking of the poll body's servers. But Justice Secretary Menardo Guevara said they will let the Comelec finish its internal probe first. According to Comelec spokesperson Director James Jimenez, they are presently validating if the Comelec systems have in fact been compromised. Based on reports, a group of hackers were able to access the Comelec servers and downloaded more than 60 gigabytes of data. Among those reportedly compromised were voter information, usernames, and pins of the vote counting machines, or VCMs.
Another presidential hopeful was removed from the Commission on Elections temporary list. From 11, the presidential candidates who still have the chance to be included in the final ballot are down to 10. Presidential aspirant Greg Arcega was the one who was removed from the list. Meanwhile, those who were still qualified in the presidential race include Ernie Abella, Leo de Guzman, Isko Moreno Domagoso, Norberto Gonzales, Ping Lacson, Faisal Mangondato, Bongbong Marcos, Jose Montemayor Jr., Manny Pacman Pacquiao, and Leni Robredo. Those who are still included in the vice presidential list are Lito Atienza, Walden Bello, Rizalito David, Sara Duterte, Manny Lopez, Doc Willie Ong, Kiko Pangilinan, Carlos Serapio, and Vicente Soto III.
For the news abroad, the U.S. Centers for Disease Control and Prevention, or CDC, advised its citizens to avoid traveling to Canada and elevated its travel recommendation for the country to level 4. Marvy Delphine details why. Good evening, Marvy.
Good evening, Elsie. Canada recorded its highest weekly total of new cases, which is 297,437 during the first week of January due to the COVID-19 Omicron variant. This is why the United States Centers for Disease Control and Prevention placed its neighboring country under the highest risk category for travel and issued a do not travel warning to its citizens. As of January 10, more than 80 places were categorized by the U.S. as level 4 or very high risk for travel, including Canada. According to Christian Dubé, the health minister of Quebec, the surge of COVID-19 cases threatens to overwhelm hospitals despite not reaching the peak of infections yet. Approximately 20% of COVID-19 tests returned positive in Quebec. An all-time high record of 2,554 patients are in hospitals and 248 in intensive care units. The influx of infection has also overwhelmed the testing capacities of Newfoundland and Labrador. Elsie?
Marvy, what measures are being done by the Canadian government to address the increasing COVID-19 cases?
Elsie, some cities like Quebec are fast-tracking their vaccination efforts and opened up appointments for booster shots for those aged 40 and above, while many provinces delayed their face-to-face education. Elsie, the federal government also committed a 4.8% increase in healthcare funds for 2022 to 2023. Back to you, Elsie.
Thank you, Marvi Delphine, reporting live from Australia. The authorities identifies the cause of the horrific fire which killed 17 people, including children. According to the investigation, fire only happened on the second and third floors, but victims were found on every floor. Charisse Longbowen tells us why live. Go ahead, Charisse.
Good evening, Elsie. A malfunctioning space heater was identified as the cause of the Bronx apartment fire, which led to the death of at least 17 people, 8 of which were children, and more than 60 people injured. The fire incident, described by New York City Mayor Eric Adams as horrific, painful moment, happened only on the second to third floors. But with the door to the apartment left open, smoke reached the entire 120-unit building, with firefighters finding victims on every floor suffering from cardiac and respiratory arrests. Mayor Adams stressed on teaching the children the importance of closing the doors in saving lives by slowing down the spread of fire.
We want our children to receive the same level of reinforcement. Muscle memory is everything. And if we can drill that in, we can save lives by closing the doors.
Officials of the city pledged to help those affected of the incident, and those who would like to give assistance may donate money through the Bronx Fire Relief Fund, launched by the NYC Mayor and the Mayor's Fund to Advance New York City. Elsie?
Thank you, Charisse Longbowen, for that live report. Former State Councilor of Myanmar, Aung San Suu Kyi, receives 4 additional years of imprisonment over new charges ruled by the military court. Queenie Rivera has the details. Yes, Queenie?
Elsie, Aung San Suu Kyi was found guilty of possessing unlicensed walkie-talkies by Myanmar's military-ruled court on Monday, sentencing her to 4 more years in jail. The ousted civilian leader was already given a reduced sentence of 2 years after being convicted of breaching COVID-19 rules last December, now totaling her imprisonment to 6 years. Suu Kyi has been in detainment since February last year after the military coup, and according to the United Nations Humanitarian Rights Organization, the new charges are merely a tactic used by the military forces to justify her already unfair detainment. Asia Director Phil Robertson of the Human Rights Watch called out the military's convictions, stating that Aung San Suu Kyi is a symbol of her country where a power-hungry military group is using political hostage to gain control. Aung San Suu Kyi is known for winning a Nobel Peace Prize for working to bring democracy to Myanmar. Back to you, Elsie.
Queenie, aside from Aung San Suu Kyi, how many more people have been arrested after the military coup? And are there humanitarian groups who are helping them?
Elsie, Suu Kyi is only one of more than 10,000 people arrested by the military junta since February 2021, after the coup triggered nationwide demonstrations. Also, according to the Assistance Association for Political Prisoners, more than 1,300 individuals have been killed after the military crackdown on protesters, activists, and journalists. Several countries and humanitarian groups, including Amnesty International, are already actively fighting to free the civilian leader. Elsie?
Thank you, Queenie Rivera. The normally glamorous and star-studded Golden Globe Awards that once drew up to 18 million television viewers was instead held as a live blog last Sunday night. The Hollywood Foreign Press Association proceeded with its film awards, announcing the names of the film and television winners on the organization's social media feeds. The Power of the Dog and The West Side Story dominated the top prizes. Nicole Kidman wins Best Actress, while Will Smith was named Best Actor in a Motion Picture Drama. New Zealand director Jane Campion became the second woman to helm a film that won the Best Drama Film prize, and South Korean actor Oh Young-soo won the country's first Golden Globe for his role as Player 001 in the Netflix hit Squid Game. And those are the reasons behind the news in other parts of the globe. I am Elsie Marcos, live from Auckland, New Zealand. Good evening.
And in other news, more than 100 government officials and private individuals have formally expressed their requests for protective custody to the Commission on Election. Leah Ilagan has the details why exclusive.
The 150-day election period for 2022 polls has begun last Sunday. In connection to this, the Police Security and Protection Group or PSPG recalled the protective security personnel assigned to government officials and private individuals. There are 173 government officials and 193 private individuals who are protected by PSPG. However, PSPG spokesperson Police Major Jackson Cases said 128 of them have already applied for an exemption from the Commission on Elections and formally expressed their request to continued protection.
Para din naman po sa mga PSP natin na nakapag-apply na po yung kanilang mga protectives ng Certificate of Authority, hihintayin lang po natin yung document na coming from the Comelec na sila po ay allowed na mag-provide ng protective security, at pagka meron na po tayong Certificate of Authority, i-issue na po natin sila ng letter of order para po sila ay makabalik sa kanilang mga protectives.
Police Major Cases said 592 PSP have been recalled nationwide. 273 of them are from Camp Crame. If their protective fails to apply for a Certificate of Authority for security detail, they will undergo a VIP security and protection refresher course. Major Cases reminded those who will be assigned to politicians to wear proper uniform while performing their duties.
Kung ang ating protective security personnel ay madidetail sa isang kandidato ngayong eleksyon, ang kanilang dapat suotin habang sila ay nagpo-provide ng security ay yung ating tinatawag na GOA C o yung General Office Attire Type C uniform. Para naman po dun sa mga hindi naman tumatakbo ngayong eleksyon at sila ay magpo-provide ng protective security, ang kanilang attire po ay yung tinatawag naming blue-gray barong ng PSPG, provided na nakakabit yung PSPG pin sa kanilang kwelyo, nakasabit yung ID.
The PNP leadership also reiterated to its personnel not to get involved in politics or even in the distribution of election paraphernalias. Leah Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
Myanmar's Church of God International continues to show that MCGI cares. In Hong Ghana, Africa, MCGI granted a family's wish for more goods to sell, to earn more, and sustain their needs. Nina Armilio has the story.
Felix grew up as a handicap, but despite his physical disabilities, he wanted to strive to survive. He fell in love with Enyonam and has formed a family with her. Now 40, he's a father of 2 and really wants to provide for his family. Although his legs and feet are hindering him from earning more money, he does what he can.
Ike ma awungi nenye de krama suru akenya majana gbagba plus ma strike na de vio hona ku fami tama wona angi do we video kula bajaja.
And Yonam also finds ways to be able to put food on the table.
Aba miaba do now like asronya hamanyong selong na namota. Iha no tukara lawo gonyawata zipiano ida kakbomba miaba fa mana suida kafa kota. Aba miaba do now like asronya hamanyong selong na namota.
Felix and Yonam are also worried about how to sustain their children's school necessities. What with their measly earnings? The parents' only wish is to be able to continue selling goods and to earn to be able to give what their children need.
Parang wika maji chumau fa ha magboy be le mia fa problem ota. Ne ba akpa jajra gali shu gangwi mola like makok pare je fa jajrang. Pla fa tritajim mo fete ha.
With God's help and guidance, members Church of God International granted the family's wish. MCGI's gifts are dried fish, cassava starch or gari, peanuts, sugar and other goods, plus grocery items from the MCGI free store.
Awu babula na nkurago haba magbula. Alaba nyama mokpomuni. Nyamanya le kahe magbulogio. Akbana mau ko sama piti.
Akbana mau. Thanks be to God for His good deeds and teachings that MCGI continues to follow with faith, hope, and love for His honor and glory, no matter the race, language, or color, to show that MCGI cares.
Before we close, we will leave you with a word, giving glory to God. From the book of 1 Corinthians, chapter 7, verse 3, it says, "Let the husband render unto the wife due benevolence, and likewise also the wife unto the husband." And those are the reasons behind the news, January 11, 2022. Reasons we deliver to you as they unfold. I am Hardin Delgado.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.
And we're not calling Omicron mild. It's milder than Delta. Delta is 3 times more likely to land you in the hospital compared to Omicron. But, Omicron can still land you in the hospital, which is a very important distinction.
Itong in process po namin na 25.45 billion po. We have to pay this in 6 months' time.
Ito po yung last contact po namin sa ating mga manufacturer, and we are now making some contingency to acquire doses that we need to include the ages 0 to 4 years old.